Welcome to the Talent Development Hot Seat Podcast. I'm your host, Andy Storch, and I'm excited that you are joining me today for another great episode and conversation to help you up your game and improve your capabilities in the world of talent development. And today we are talking broadly about learning and development, but also about learning and development specifically in the healthcare industry, which is a big industry that I know many of you work in or adjacent to or work with people in. My guest today is Geoffrey M. Roche, who is the inaugural North America Director of Workforce Development at Siemens Healthineers, where he leads all national workforce development strategy and partnerships to advance a sustainable, future-ready healthcare workforce. He is also the son of a nurse, a diversity advocate, and educational enthusiast who speaks often on healthcare workforce topics at global conferences such as HIMSS, HLTH, ASU, GSV, and a bunch of other letters. And in 2022, he was nominated to the Forbes Business Council for his national level of work. Roche has over 16 years of experience in hospital and higher education leadership in the United States, and he served on various boards and committees, including the United Way of North Carolina and many more. A lot of expertise in this healthcare space. So excited to have you here, Geoffrey. Welcome to the show.
Thank you for having me.
Yeah, I'm excited to have you. We were connected by Damon Lemby, who's been on this show a couple times and is a partner of ours, and just had great things to say about you and your expertise around the healthcare industry. But I know you're really passionate about this learning and development space in general. So I'm curious, maybe we can start there with a little bit of background. Like, how did you get into, especially the learning and development side of things?
Yeah. It's really an interesting story, really, because in a lot of ways, obviously, I didn't come into it through the more traditional lens, right? I mean, I came into it as a people leader in my healthcare system that actually saw that we as an organization weren't doing enough to support what I considered at that time aspiring and middle management. And so I was, on the upper management side of my healthcare system at that time. And I just thought we were woefully serving those that could become our future leaders and also those that were in our middle management level roles. And so I can remember I went to our CEO and I said, like seriously, like what is the HR team doing in this space? Because it doesn't look like they're doing that much from my vantage point. And she said, well, what's your solution then? And so I started to work very closely with our director. And what I learned actually, our director of learning and development was actually it was one of those resource constraints. They really, as an organization, had not properly resourced that area to make it as effective as possible. And so we started to collaborate on what could that look like. And ultimately, a lot of my work helped to elevate not just their programs, but help as a business leader help to further put forward kind of the value of L&D and tie it into. And so I'll give you an example. A lot of people are familiar in healthcare, and I'm sure you are too, with crucial conversations training.
Hmm.
What people didn't realize about crucial conversations training from an L&D standpoint is how could you tie that into actual strategic priorities? And then how do you tie that into how a crucial conversation could, yes, benefit us from a patient quality, patient service, patient safety perspective, but then B, also be a critical linchpin when we think about adaptability, when we think about agility. And so we started to really map out and put forward programs. And my area was leveraged as kind of a pilot to then leverage bringing other business leaders in. And so that's kind of the first foray I had.
Yeah, I haven't worked a lot in the healthcare industry, but I've done a few programs here and there. And one of my understandings of the bigger challenges in healthcare is that, like in most industries, uh, people are often promoted based on, being really great individual contributors, right? But unlike in other industries, most of these individual contributors are on the front line providing healthcare to people. We're talking mostly about nurses and doctors, but other practitioners as well, and that even when they are promoted, oftentimes they're still being asked to deliver patient care on the floor and in a really high pressure situation, which makes it difficult to sort of take the time to do leadership, quote unquote, the right way. Tell me if my understanding is right, and what are the biggest challenges when it comes to leadership and learning and development in healthcare?
No, you're 100% on. And I think this also gets to some of the more systemic challenges, particularly and answers as to why we also have some of the worst retention results in healthcare and also some of the poorest culture from an organizational culture standpoint as well. And part of that is, to your point, especially if you take just nursing,
Hmm.
we historically will promote an individual into a nursing leadership role without ever equipping them with the experience or different skill sets to actually be successful.
Right. It's
And
more
then what
like just
happens
keep doing
is
what you're doing and tell other people how you're doing it.
exactly. And then the problem is then you think about it from the vantage point of oftentimes they're promoted from, from a staff level nursing role where they've worked with all those peers
Yeah.
and then they become their quote unquote leader, but they don't know how to lead. And then the
Right.
problem is it impacts all the aspect of morale and further contributes to burnout. And at the same time, that person generally doesn't intend to do that. They haven't just been given the opportunity to be successful. And so it's one of the reasons why, recently actually with the Learn It team, I had shared an article that I wrote regarding middle management crunch. I mean, the middle management crunch, as you know, is very real in every industry. I
Mhm.
would argue it's one of the worst truly in healthcare. And it really comes down to if you look at the tenure of middle managers in healthcare, that number has just skyrocketed down.
Hmm.
And part of it is that it's also because we have had so many poor leaders or poor managers, frankly, that many people are saying, I don't want to be a leader. I don't want to have that role anymore. I
Yeah.
don't want to have that responsibility because ultimately, organizationally, we may not be giving enough resources and support for them to be successful.
Yeah, and it becomes, or they've had such a bad experience, and it's either the heroes, they're like, I'm going to go change this and do it right. But a lot of people saying, well, I don't want to be partake in that because I know how hard it is and what everybody thinks of the boss.
Yeah.
The other thing I was thinking of when it comes to leadership is in healthcare. Um, well, in leadership in general, I've run leadership development programs all over the world, and I think one of the biggest challenges or roadblocks for leaders in doing a great job as a leader is usually is their ego, right? They're afraid of how they look. They get caught up in micromanaging. And I know in healthcare, oftentimes when it's, comes to the medical practice on the floor, the doctors are the leaders or the managers, and they're also known for having some of the biggest egos, right? They've gone through tons of education. They've been told, look
Hmm.
how smart and great you are, and then also they know all so much is relying on the decisions they make. um how do you deal with that and combat that, because I know that that's a challenge and not something you can easily just train away.
Yeah, you have to, oftentimes in healthcare, what we talk about is sort of the onstage and offstage approach, which for those in theater, know that really well. In fact, we
Mm.
train on that in healthcare, and from an L&D standpoint, we do a lot of work around that. We have to do a lot of scenario-based training in healthcare and walk through how, one action, one word, one reaction can have a dramatic effect
Mm.
on patients, on those around us, etc. And leadership, I regularly talk about as like a make it or break it moment. And when I look back, throughout my time in healthcare, having worked obviously in global healthcare organizations, having been a hospital administrator, I regularly say I have known and experienced more toxic and poor leaders, unfortunately, than I've experienced really amazing leaders.
Mm.
But when I look at those that were amazing, to your exact question, what stands out, in fact, my former CEO, who I regularly talk about, who, if I could clone to take into every organization, I would. I always called her, and she hated it when I called her, but I called her the Mother Teresa of healthcare.
uh,
And the reason is she was so good at not ever acting like so many CEOs act like.
mhm.
She was humble. She would regularly say, I can remember her actually saying doctors in our organization would criticize her because she had a parking spot. Everyone knew her parking spot, and she would drive in with her Hyundai Sonata. And people would say, "You're the CEO. Where's your BMW? Where's your
Yeah.
Mercedes?" And she'd say, "Excuse me, it's got four wheels. Is it getting me point A to point B? That's what I matter." And there was a lot of reasons for that. She was also very charitable to people in our organization, charitable to our community, charitable to the region. In fact, she helped fund a homeless house for veterans out of her own pocket
Wow.
because there wasn't the investment at the time from others to do that. And it was a big issue in our community. She just cared so much about those types of things. But more importantly, from a leadership standpoint, she was one of those leaders that did walk around leadership. And when she did walk around leadership, she did it from the vantage point of listening, learning, and making sure that the team knew at all times that she had their back. And I'll never forget some circumstances where when she would do that, and I had the privilege of reporting to her for several years, she would literally, we'd come onto a nursing unit and she could just see the vivid, the vivid and visible stress that they were facing. And she would go, Jeffrey, you stay here, I'll be back. And I was like, okay. And all of a sudden she'd come back with her scrubs on. She would go right in and she would start nursing. And she
Wow.
said to me, I will never forget where I came from. Once a nurse, always a nurse.
Hmm.
Yes, I'm the CEO, but guess what? When I'm there practicing, that's when I actually hear the most important pieces.
Hmm.
And so I think what I learned from her, and I had other leaders like that at that organization as well, and I think a lot of it was because of her impact,
Sure.
was when you think about learning and development, when you think about culture, when you think about retention, when you think about all these things that learning and development are now so responsible for, at the end of the day, it really does come down to having an executive and an executive team that really wants to model the way and wants to
Yeah.
hold people accountable when they're not following through. And then, yes, obviously they have to invest in this space as well. But those are the types of stories that I think about.
Yeah, I mean that's amazing, and it's always wonderful when we come across leaders like that. And like you said, you've had your share of toxic leaders. I have as well. I've also worked for some really great leaders who, or at least a couple who truly cared about their people and looked for their strengths to leverage those, and were humble and also held people accountable. A really nice mix. And some of those people are born like that. But at the same time, we're charged in learning and development, talent development, to develop leaders as best we can. So, what's talk about the importance of learning and development, especially in healthcare, but even more broadly. Where has it maybe gone wrong in the past, and what do you see as some of the best practices or trends today?
Yeah, when I think about in many ways where it has gone wrong, and I know sometimes I actually ruffle feathers when I say this, but it's just been my experience.
Mm.
In many ways, many people have come into the learning and development, talent management space from more traditional human resource backgrounds. And the reason I highlight that is that it's my humble opinion, having worked especially in the healthcare space and in the education space, that oftentimes people that come up through that background tend to be more transactional. And it's actually not that different when we actually study it and then understand. It's one of the reasons why L&D has historically reported the number of students in a class, in a training. It's very transactional. They take the class, they do the class, we're done. We report that they completed it. And so, one of the shifts that I have often felt we have to do, and things that I've seen as best practices more and more, is how you tie that to my earlier point on business value, how you tie it to strategy, how you tie it to outcomes. Because the reality is that L&D is transformational. You can't be viewed as transactional. And
Mm.
so, inherently, for those that have come up through that more traditional lens, I have said you should hire some other subject matter experts that have actually worked on the business side
Mm.
into your team to really supplement what expertise you have. And I think those leaders that have done that have had great success. And I've seen that in many organizations. I think about, I know recently I heard Johan at Merck talk about some of the work that he has done with his team to literally tie everything in L&D into the business strategy. And it has been a phenomenal success and strong results in the life sciences to demonstrate. And so much so that now leaders are saying, well, you did so well at doing that. Like now we need more of that. And then
Mm.
obviously the opportunity is to say, well, yeah, you need more of it. Well, you need to invest more so that we can actually help equip and grow and get those outcomes. And so I think it really is that necessary element to really be a part of the transformation and be able to tell people, no, this is what you need to move your business unit forward instead of the business unit coming and saying, hey, we're dealing with this challenge. What do you think we should do? Ultimately, we've got to be in a position to say, no, we know what your challenges are. Here's what you need to do.
Let's talk about the, you know that was- the- let's talk about learning and development in the healthcare industry specifically, and what needs to be done there, and why learning and development is so important. When I think about healthcare, I think especially again to the people on the front lines, the nurses and doctors already have to go through so much education to get to where they are. But there's also an important element of ongoing education. There's human skills to develop. So, can you talk about the importance of learning and development specifically in healthcare?
Yeah, I mean, like when we think about it from a healthcare perspective, obviously, most regulated industry, most, definitely highest level industry with a focus on continuing education that obviously connects back to licensure, connects back to regulatory, Joint Commission,
Mhm.
Department of Health, CMS, you name it. I think the challenge healthcare has had, though, with that understanding is for so long we've done learning and development through that lens. We've done it through the lens of it has to be a compliance, it's a risk management, instead of, yes, that's important, have to do that. And how do we make it talent and career mobility focused? How do we make it aspirational? How do we make it about people achieving their dreams? How do we make it about, true leadership development, true succession planning? And I think that's the shift that's been necessary. Now, I will also say it's just my anecdotal evidence that healthcare is also woefully invested in learning and development. When I look at the size of learning and development teams, even at some of our largest pharma companies, medical device companies, hospitals, and healthcare systems, we're not giving them an opportunity to even try to be successful because they can't scale. And I think in the world that we live in now, where it's so virtual, remote, hybrid, you have to be in a position to be able to scale. I think about, I have a dear friend who's a chief learning officer at a very large digital health company. And I was with her recently speaking at a conference, and her comments to me prior to us going up there were like, the demands on my area are just astronomical. Yet I've had to reduce every quarter in my area.
Hmm.
And when they ask us to do more, I look at them and I say, well, you just took away the resources, but you want us to do more. And so I think, that's very real in healthcare, unfortunately. It's one of the areas that first is looked at, even though it's also now all about retention, all about culture, all about career mobility, talent management. It's still, unfortunately, on the chopping block so often.
Hmm. Interesting. So how the other challenge I imagine with healthcare, especially going back to having so many workers in the front lines, and there's many other industries, of course, that have frontline hourly workers who are out there, spending most of their time doing almost manual labor like work with their hands as well as their minds, is that it's really hard to get people to take time away for learning, right? You can't just say, hey, let's block Tuesday and everybody, don't have meetings and go to this class when there's still patients coming in. So how do you think about getting the getting development to the people who need it in like a timely and effective manner when they also have such high demands of being on the floor and on with patients or customers all the time?
Yeah, and that really, becomes how do you make the education and the development actually related and specific to their roles, right? And there's been definitely some creative work done in that space to make it more micro learning, allow them to be able to do some things on their mobile phone because, there can be times where they may get a moment to be able to do those types of things. Make it enjoyable. Don't make it a one size fits all type of an approach. In fact, I was just recently talking about this. In many ways, I'm fearful that one of the challenges in this exact to your exact question is we've created programs through a lens of generations that are leaving the workforce instead of actually creating it for a lens of the generations that are in and will continue to come into the workforce. And when I think about our younger generations, where they learn a lot in various different ways. I mean, I look at my own children that are young, but even teenagers, those entering college, they learn a lot on TikTok, right?
Mm-hmm.
And I can't envision sending them to an LMS in a traditional LMS and saying, "Hey, learn there." That's not how they learn. And so we've got to figure out, and to your exact point, it's one of the reasons why clinical areas, even on the compliance related training, are generally the last to complete it because they don't generally get as much time to do those things. And so the
Mm.
obvious point is how do you create a way for them to do all those things and then also make it engaging, make it enjoyable, and
Mm.
allow them to do it and pay them for doing it too. That's the other piece here is
Mm.
they're so busy they're not going to do it on their own time.
Right.
It has to be done, during their workday. And so there has to be, a way of prioritizing and actually agreeing to invest in them so that they can invest back into the organization by providing the service that they provide.
I would imagine too that sometimes that's a tough sell to hospital administrators that are overly concerned with, hey, we just need to make sure that we're taking care of patients, that nurses are always on, and then getting the rest they need, and that sort of thing. When I think we all know we take a step back, like ongoing education is so important. It for learning and development to sell them, people taking paid time out to do learning, is that sometimes a tough sell, or does everybody understand the importance of that?
It can be a tough sell, right? And, I think, but when it comes down to it, that's where we have to be able to educate everyone, right? I mean, ultimately, retention is such a significant challenge in healthcare today. But at the same time, what we see in pretty much majority of employee engagement surveys and other ways of feedback that's offered is the workforce says we want to be invested in. We want to have that opportunity to be invested in. And so, particularly the younger generations, they want to be upskilled, they want to be reskilled. And so, the element there that I think organizations have to think about is how do you redesign the workplace, which can still be done in healthcare.
Hmm.
If you think about it, 12-hour shifts, you got to be strategic, you got to be thoughtful. Um, I think at the end of the day, we have to look at the full structure and we have to acknowledge that regardless of its pharma, medical device, hospitals, etc., the whole life sciences, maybe our workspace, our workplace has still been designed for a time that doesn't actually exist today.
Mm,
And how do we think differently about it and actually have a solution that fits the five different generations?
yeah.
That I think is a central question we have to be asking ourselves.
Is that something that we need to be thinking about accommodating? The idea that you mentioned there's five different generations, there's multi generations in the workforce. Because sometimes I hear people say like, "Oh, we have to really account for that and address that." And other times I think like people are people; they kind of want the same things, but it may depend on the industry as well. Do you see that being a big issue that needs to be addressed in learning and development?
I do.
Yeah.
And the reason I do is that when I look at like the life sciences particularly, it's been my own experience. It's certainly been my experience of traveling to hundreds of hospitals and in engaging in the global med tech and the pharma space that when we look at the learning and development space, it's definitely a space today that is still offering solutions that are not necessarily in touch with where the modern learner
Mm.
is at. And not unlike, in many cases, higher education, also not necessarily in the space of where the modern learner is at. I think about the movement in the US we have, which has still been super slow, in my opinion, to work-based learning, apprenticeships, those types of things. In fact, I tell all learning and development professionals, if you want to look at, especially in healthcare, if we want to look at a sustainable approach, we've got to push towards a more apprenticeship type of option. In fact, I'm a big believer in apprenticeship degrees. We've got to have higher ed partners, accreditors that want to dive further into that space because when we think about equity, when we think about learning, when we think about career mobility, talent mobility, that's an easy way if we actually unruffle all the things that are barriers to get there.
You're saying for
But we
people to go
still
back
are
to like an apprenticeship model where they're actually working under someone, following someone, learning from them directly rather than just sitting in a classroom learning theory.
100%. Because
Mm.
the reality is when you learn and earn on the job, you're not only contributing into that work, but you're learning. So like in the United Kingdom, I mean, last summer I spent time, I went to our Siemens MRI facility where the magnet is made for all the MRI machines. I got the experience to meet with apprenticeship degree students who are earning their degree and earning on the job, fully paid for by Siemens. And their faculty have all been incorporated into that. And so the curriculum is very work-based, very industry focused. I similarly went to the NHS hospitals, obviously the largest hospital system in the United Kingdom, had the experience of touring, visiting with their students, talk about a model that has so much. And I met with their L&D team when we were there too. And what was super awesome about it is talk about learning transformation. There were so many students there who literally started as a young middle
Yeah.
high school student in that hospital in a paid job as a youth apprentice, and were, growing, and now we're nursing students
Hmm.
or respiratory therapy students, but they already were in that system for 8 years.
Right.
You talk about
They know it well.
longevity, talk about, talent mobility.
You mentioned equity in there as part of the factor in apprenticeships. Your profile, your LinkedIn profile mentions advancing health equity as part of your role. How are you incorporating, what does that mean, and how are you incorporating equity considerations into workforce development strategies?
Yeah. And I know obviously this is a topic that doesn't get as much focus, unfortunately, right now in the US because of, just where we sit. But the reality of it is that in the healthcare space, you have to have a workforce that can relate and connect with the community that they serve. It's one of the reasons why, if you look at women's health in the United States, we still, in the US, stand far behind many other countries that are similar to us in the issues of maternal mortality, because we've had a workforce that doesn't necessarily understand the unique needs, particularly of Black and African American women, the way blood pressure affects them, the way different cardiac issues affect them. And so when you think about pregnancy, different things can be experienced. And when they say something's not right, you've got to have someone on the team that can relate and understand and say, you know what, I've had that experience too. We need to work that up. That's why equity in this space is so important. It's one of the reasons why I strongly believe in the work-based learning model of engaging people earlier so that you can bring people from different communities into our healthcare systems.
Hmm.
It's so important. And when we've seen investment, when we've seen a focus in this space, we have seen significant quality outcomes improve.
Hmm.
And, you know, obviously the US is going to take some significant steps back in this space, as we're clearly seeing. But I think there's still ways for healthcare systems and employers and others to continue to take steps forward, regardless of the policy changes.
I saw you were also an advisor to DNPs of color, and I'm just curious about when you think about leadership pipelines in healthcare, does that go, how do we improve that? Does that go back to the apprenticeship model you mentioned, or are there other things that you're working on?
Yeah. Yeah. So, let me just say, huge shout out to DMPs of Color, amazing organization. Love their founder, Dr. Danielle McCamey, and what Danielle has done
So,
is
and sorry,
it's
just to interrupt, DNPs is doctors and nurse practitioners.
Yes, yep, doctors of nursing practice, but it's very inclusive. And so the idea of it, Andy, was that the group was founded through Danielle's experience, which, Danielle is a nurse practitioner that also has earned her doctors of nursing practice. But in healthcare, obviously, you have the whole physician nursing dichotomy that's existed. But then you have the dichotomy that when you're a person of color, getting your seat at the table to elevate nursing practice or clinical practice can still be very significantly challenged at times in different environments. And so they were founded on the principle of getting people access, opportunity. And, I was super, super proud to have been a founding advisory board member for them. You know, to your exact point, this is a super important space. And when we think about leadership, it goes the same exact way. You've got to have leaders that have relation, understanding, connection to really understand why these matters are important. You've got to have a commitment to this work. It's almost like when I was talking about my former president and CEO, one of the reasons why she cared so much about all of this type of stuff when I was talking about the homeless, when I was talking about even the stuff she did in learning and development, is because she didn't forget those that supported her to achieve her dream of going from a young girl that grew up in New York City to becoming a nurse to ultimately working her way up to be the first female president and CEO. And but at the same time, to your question, I had the great fortune of staffing her when she served on the American Hospital Association Metropolitan Governing Board, which was the board of the presidents and CEOs of multiple Northeast states. She was the only woman.
Hmm.
for many years on that board. And she would tell me there were many meetings regularly where people would talk over her.
Hmm.
And she had to fight to still have a voice at that table. Now, the reality is that she did, because as you heard me say, she was the Mother Teresa of healthcare. She would find her way in there patiently, but when she got in, there was no way she was going to stop. And that's the thing we have to remember. I often say in healthcare, we haven't done a great job of allowing the diverse voices to have a seat at the table. And it's one of the reasons why I think we still have the workforce challenges as bad as we do.
Yeah, no kidding. Let's talk about the future of healthcare and leadership, where things are going. I know this is something that you study. I believe I saw you're also working on a PhD in leadership. And I'm curious what the focus is there, and is that related to healthcare, and how you see leadership evolving in healthcare now that you're really studying this closely.
Yeah. Yeah, so my focus is definitely in the healthcare space, and I haven't fully yet decided what exactly my dissertation is will be. I got to decide very quickly. It's definitely going to be something around leadership, culture, and sort of that connection, because that's what I've been preparing for. But I just haven't decided if it's going to be larger or very, singular focus in one specific part of healthcare. But I will say, you know, I have to be honest, I'm super scared because the reality of it is the middle management crunch is extremely real. At the same time, we're seeing retirements at very, very large numbers at many, critical roles in healthcare. It's also coming at a time where science and healthcare, as we know it, are under clear attack
Hmm.
in the United States. And so we have to be honest and acknowledge that because that's the truth as well. And it's coming at a time where we're seeing much higher attrition than we've ever seen before. And so the obvious piece that's super critical from a leadership standpoint is modeling the way and doing a lot more around what I consider to be, traditional storytelling. We've got to help people understand, how I look at a former executive I worked with, and he would never forget that he started literally as a dietary aide
Hmm.
and obviously worked his way up to a senior vice president, where he oversaw most of the things in the healthcare system. But he never forgot that role as a dietary aide. And he regularly would talk to us about how in healthcare, we haven't done a great job of helping people understand the different pathways and different ways you can get from here to there. Whatever your dreams are, whatever your goals are, we've got to do that. And so, one of the reasons why I believe very strongly in youth career pathway type of exploration is we've got to help people clearly understand there are a lot of pathways in healthcare, clinical or non-clinical, and we've got to do a much better job of presenting those opportunities and then knocking down the barriers that may not allow us to engage those youth earlier. Uh, the under 18 barrier, for example, is just baloney. There are ways to actually, clearly work within those realms, work with the state to change those rules if it's a rule. There's people that go into farming areas and go into other areas of very high potential for injury. And healthcare has done a phenomenal job of limiting that across the years and across the board. We've got to be thinking differently about this type of stuff because we're in trouble based
Hmm.
on the stats.
Our audience that listens to this podcast works primarily in talent development, learning, and development across lots of different industries, big companies and small. Is there anything else? What else do you think is important to mention that you've learned through your career about learning and development, talent development, that you think is really important to pay attention to right now?
Yeah, I think it goes without saying that, in my view, this has been a space that has also been too humble. It's not a space that we've regularly shared the stories, the examples, highlighted the critical work that occurs. And I think so often it's a space that's tasked with certain things and that delivers, but then doesn't necessarily, tout that critical work that they did. And so I would just highly encourage getting out there and talking more in their organizations about all that they do. Share those stories because it is transformational. I look at this field, and obviously I didn't come up through traditional means, but I look at it as I've definitely never been in my career around a specific subset of a group of people who care more about people. Yet those stories are not always shared in that way. And then, it's easy at times for an executive to say, well, we don't really need to invest more in there because they're just kind of doing it status quo. We really need to help everyone understand that what we do is life changing. What we do uh, is helping people achieve those dreams. What we do ultimately has the immense impact on whether it's our patients, whether it's our consumers, whether it's our customers, and executives who don't understand that have to, because the reality of it is the data is there when we tell the story.
Mm. Geoffrey, are there any other trends that you're following right now or excited about in the world of talent development?
I mean, obviously, everyone talks about AI, right? I mean,
Yeah.
in the healthcare space, I definitely get excited about the proper ways to leverage AI to further scale, because
Mhm.
I think that there are limitations for sure within existing infrastructure, and AI can play a pivotal role when we use it safely and effectively. I would say, the other trends that I definitely am, very much, deeply engaged in, we've talked about, is really the big push to move towards more work-based learning and apprenticeship degree models.
Mm.
I am super encouraged by the current U.S. Department of Labor. There's a lot of leaders in those areas that believe very strongly in this space, and so it's one area that I'm encouraged by. We've got to have growth and movement in there, and I think that for anyone in this L&D space, that has to be a space where you've got to have a clear role. The final point I would make is I would strongly encourage L&D professionals, especially in healthcare, but it's the truth in every industry. You as an employer have such a powerful voice. And I can't tell you enough examples where I've seen a higher ed institution or an ed tech company or another active player in this space want to do something innovative, but an accreditor or someone on the licensing board says no. But when the employer steps in and says, well, no, I need this, and says, we need this solution, so much can change. And so I would encourage L&D professionals to own that. Uh, Own the fact that you want to transform your workforce, because when you transform your workforce, you transform your community. And when you transform your community, you have the potential to help transform a state, and then we get to the whole country. Now's the time to be ambitious. Certainly, now's the time to be bold. And certainly, I think let's collaborate to make that necessary change happen.
Well, I think we will finish on that. Bold words to finish there, Geoffrey. I appreciate that. If anybody wants to reach out to you to talk about collaborating or find out more about what you're doing, where's the best place for them to go?
Yeah, easiest place is to connect on LinkedIn, and happy to start there and have any conversation.
All right, we'll put a link to your profile in the chat. If you are listening in the chat, we'll put a link to your profile in the show notes. If you're listening and you haven't connected with me on LinkedIn, come follow along and connect with me. Let me know that you listen to the show. Reach out and connect with Geoffrey as well. Geoffrey, this has been phenomenal. Thank you so much for coming on and sharing some of your insights and lessons from, especially working in the world of healthcare, but learning and development and equity more broadly. I really appreciate it. And I look forward to keeping in touch and talking more in the future.
Sounds good. Thank you so much as well.